She wasn't supposed to be there when the blood hit the floor. The old man in the corner of the ER waiting room had been sitting for 47 minutes, and nobody had looked at him once. Not really looked. He wore a faded army jacket with a patch on the shoulder that most of the staff probably couldn't identify, and he was pressing a folded handkerchief against his left forearm with the particular stillness of a man trained not to make noise about pain. The handkerchief had gone dark red 20 minutes ago. He just kept pressing. Emily Carter noticed because she always noticed. It was a habit she'd spent 4 years trying to unlearn and couldn't. She was in the middle of charting a pediatric discharge when she clocked him. The rigid posture, the controlled breathing, the eyes that stayed flat and forward even as his face went a shade paler. She closed the chart tablet, told herself it wasn't her problem, and walked over anyway. "Sir." She crouched in front of him. "Can I see your arm?" He looked at her badge first, then her face. "You're a nurse." "I am." "I didn't want to make a fuss." She peeled the handkerchief back gently and kept her expression neutral. The laceration ran 4 inches along the inside of his forearm, deep enough that she could see the tissue layers separating every time he flexed his fingers. It had been bleeding for a while. Not life-threatening yet. That word yet did a lot of work. "How'd this happen?" "Shop accident. He stopped. "I didn't want to be a problem." "You're not a problem," Emily said, and she meant it without sentiment. "I'm going to get you into a bay and close this up, okay?" He studied her for another second, the way old soldiers study things, weighing, not stalling. Then he nodded. She got him into Bay 6, which was technically overflow and not officially her assignment, and she started pulling supplies from the cabinet. Irrigation syringe, betadine, 4-0 nylon suture, needle driver. Her hands moved before her brain finished the sequence. That was also a habit she hadn't unlearned. She was 3 sutures in when the curtain yanked back. Dr. Harlan Vogel was not a bad doctor. He was, however, a spectacular administrator, which in Emily's experience meant he'd developed a precise sense for which moments would make him look important. He stood in the curtain gap with his arms folded and his lanyard swinging, and he looked at the suture in her hand with an expression like she'd walked into his office and put her feet on his desk. "Carter." His voice was its own kind of scalpel. "What is this?" "Laceration repair. 4-inch wound, good depth. You're a floor nurse, not a physician, not a PA." He stepped into the bay. "Stop what you're doing." The old man's eyes moved between them. "He's been in the waiting room for almost an hour," Emily said. "He was losing blood. There was no one—" "That is not your call to make." Vogel's voice dropped in volume and rose in precision. "You do not perform procedures outside your scope without authorization. That is hospital policy. That is JCAHO standard. And frankly, Carter, it is the 3rd time this quarter I have had to have this specific conversation with you." The 3rd time. As if the first 2 times hadn't also been her doing something useful that he'd walked in on. "He needed sutures," she said quietly. "He needed to wait for a qualified physician." The old man spoke. "She's doing a fine job." Vogel didn't look at him. "Sir, we'll have someone with you shortly." He looked at Emily. "Stop the procedure, now." She looked at the wound. 3 sutures in, the bleeding was already significantly reduced. She had maybe 4 more to place. If she stopped now, someone else would have to re-prep, re-numb, start over. And the tissue had already been handled. The closure would be worse. She placed suture 4. Vogel's breath came out flat through his nose. "Carter, I'm almost done." "Emily Carter, you put that needle down, or I will write this up as direct insubordination, and we will have a very different conversation than the one I was planning." She placed suture 5. The bay went very quiet. She tied off, cut the tail, did a final inspection of the closure line. Clean, even tension, good approximation. She dressed it efficiently, applied the tape strips the way she'd been trained to apply them. Not hospital trained, the other kind. And she pressed the old man's hand once before standing up. "Keep it dry for 48 hours. Come back if you see any redness spreading beyond the edges." He looked at her. "Thank you, young lady." She turned around. Vogel was already on his phone. A sec. The formal meeting happened at 2:17 p.m. in a conference room that smelled like recycled air and institutional carpet. Emily sat on one side of the table. Vogel sat on the other with HR Director Pamela Strick, who had the posture of someone who had delivered a lot of bad news and learned to do it without blinking. There was a written statement. There were 3 policy citations. There was a section of her employee file that Strick slid across the table with practice neutrality, and Emily looked at it and understood she was not in a meeting. She was in a conclusion. Northgate takes scope of practice violations very seriously, Strick began. The patient was actively bleeding, Emily said. That's not the... He'd been in the waiting room for 47 minutes. I checked the triage log before I came in here. She kept her voice even, not conciliatory, just even. There was no physician assigned to the overflow bay. There were no available PAs. He was a 60-something man in a veteran's jacket pressing a saturated cloth against a deep laceration and not saying anything because he didn't want to be a burden. Strick looked at Vogel. Vogel said, "This is exactly the pattern of behavior we've been documenting." Pattern, Emily repeated. You operate as though your individual judgment supersedes established protocol. You perform assessments and interventions outside your designated scope. You undermine the chain of, I sutured a wound. You performed a procedure without physician authorization. Vogel leaned forward slightly. And before you make another speech about the patient's condition, understand that this is not about that patient. This is about the fact that you consistently act as if the rules that exist for everyone else don't apply to you. And we have tolerated that long enough. Emily was quiet for a moment. She thought about saying several things. She thought about the 18 months she'd spent at Northgate, the quietly accumulated record of patients who'd been discharged in better shape than expected, the 2 codes she'd called early enough to matter, the sepsis she'd flagged in a woman who'd been waiting for a routine exam and had actually been 40 minutes from a very bad outcome. She thought about the fact that none of that was in the file Strick had slid across the table. She thought about saying all of it. She said, "Okay." Strick blinked. It was the first genuine reaction she'd shown. "Okay," Vogel said. "I understand what you're telling me." Emily picked up the copy of the termination letter they'd placed in front of her. She read it, actually read it, not performatively, because she wanted to know exactly what it said. Then she set it back down. "Is there anything you need me to sign?" There was a pause that lasted slightly longer than it should have. "Just the acknowledgement form," Strick said, recovering. She slid another sheet across. Emily signed it. Her handwriting was plain and legible and didn't change under pressure. Another habit. "You'll need to turn in your badge and access card at the nursing station," Strick said. "We can have security." "I know where the nursing station is," Emily said. She stood. "Thank you." She walked out. The nursing station was a particular kind of theater. Word had already moved through the floor the way hospital gossip always did. Slightly ahead of the facts, slightly louder than necessary. 3 nurses she'd worked alongside for over a year looked at her with the expressions people use when they're deciding whether to say something. One of them, Dara, opened her mouth. "Emily, I heard." "It's fine," Emily said. Not harshly, just cleanly. She pulled her badge lanyard over her head and set it on the counter. Her access card went beside it. She opened the drawer where she'd kept a few personal items, a good pen, a spare hair tie, a photograph she'd shoved face down on day 1 and never looked at since, and she put them in her scrub pocket. The photograph she looked at for 1 second before she put it in her pocket. 4 people in desert gear, squinting against the sun. She was third from the left. She looked younger and also somehow older. The person to her right had his arm over her shoulder and was grinning like an idiot. She folded it and put it away. Someone had found a cardboard box somewhere, one of those small copier paper boxes that appear in hospitals like they grow out of the walls, and set it on the counter near her. She didn't know who. She put the pen and the hair tie in it. That was everything. The walk to the elevator took 40 seconds. She knew because she'd walked it every shift for 18 months, and the distance was just something her body knew. She pushed the button for the lobby. The doors closed, and she was alone in a small metal box for the first time all day, and she let out a breath that had been sitting in her chest since the conference room. She did not cry. That wasn't self-suppression. She just genuinely did not feel like crying. She felt something flatter and stranger than that. She felt like a person who had known for a long time that something was going to happen and had now watched it happen and was filing the information. The lobby was mid-afternoon quiet, pale light through the glass doors, a few people in chairs, an information desk volunteer who looked up and then looked away. Emily pushed through the glass doors. The air outside was cooler than she expected. The parking lot stretched out flat in front of her, and she started walking toward the section where she'd parked that morning, cardboard box against her hip, and she thought about what she was going to do when she got home. She thought about the lease on her apartment, which was up in 3 months. She thought about the half-finished jar of peanut butter on the third shelf of her refrigerator and whether she had bread. She thought about small concrete things because she was good at that. She was thinking about the bread when the sound hit her. It came from above and to the north, a low rhythmic thudding that she identified correctly before she consciously registered it. Her body identified it. Her body had a lot of opinions about that sound that the rest of her had spent years trying to diplomatize away. She stopped walking. The helicopter came in low over the tree line to the north of the building. Not a medical transport. She knew the profile of the hospital's air transport contracts, and this wasn't one of them. This was military. Navy, specifically. She could read it in the paint scheme even at this distance, in the way the rotor configuration sat. It was moving with intention, not searching, and it was coming down toward the hospital, toward the roof. The thudding deepened as it descended, close enough now that she could feel it in her sternum. People in the parking lot had stopped moving. A few looked up. One took out a phone. Emily stood with the cardboard box under her arm and watched the helicopter settle onto Northgate's rooftop landing pad with the kind of precise authority that came from pilots who had landed in places much worse than suburban hospital rooftops. The rotors were still turning when the door opened. 4 people came out. The distance made exact identification difficult, but Emily had spent enough time around military personnel to read body language at range. 3 of them moved like escorts, aware, positioned, scanning. The 4th moved like someone who didn't need escorts but had learned to accept them. That one was older, carried rank the way some people carry weight, distributed through the whole body so you didn't notice it until you were standing under it. They went through the rooftop access door and disappeared. Emily stayed where she was. She should keep walking. She was not an employee of this hospital anymore. She had the paperwork in her pocket and a cardboard box as visual confirmation. Whatever was happening on that roof had nothing to do with her. She stayed where she was for another 30 seconds. Then she heard the second sound. An alarm. Not a medical alarm, the security alarm. The one they tested every first Tuesday of the month at noon. The one that meant access-controlled areas were being opened or demanded. She knew the difference between the sounds. Another habit. She started walking back toward the building. Basam. The lobby had changed in the 10 minutes she'd been gone. 2 of the Navy escorts were already at the information desk, and the volunteer, a 60-year-old retired schoolteacher named Mrs. Brandt, who had never once looked rattled by anything in Emily's presence, was visibly rattled. A 3rd escort was positioned near the elevator bank. The 4th, the one who moved like rank, was speaking to Vogel. Vogel had appeared very quickly, which told Emily that someone had called him as soon as the helicopter touched down. He was doing the thing he did when he wanted to look authoritative, standing with his shoulders squared and his hands clasped behind his back, but his face was doing something else. His face was doing uncertainty. Emily stood inside the lobby doors. Nobody had stopped her. She was carrying a cardboard box of personal effects and wearing scrubs. She looked like a nurse because until 40 minutes ago, she had been one. She couldn't hear this conversation clearly from this distance, but she watched Vogel's posture. She watched the moment it changed, the shoulders dropping slightly, the clasped hands separating, one hand coming up to touch his own lapel in that self-conscious gesture people made when they suddenly needed to check that they were dressed correctly. He was saying something that looked like an explanation. The person in front of him did not look satisfied with the explanation. The person in front of him, she could see him more clearly now. Late 50s, silver at his temples, the physical bearing of someone who had not spent his career behind a desk. He was in Navy dress uniform, and the insignia on his shoulder boards were visible even from across the lobby, and they were not small insignia. He was a flag officer. Emily had not stood in front of many admirals. She had stood in front of enough to know what one looked like when they were not happy. Vogel said something. She could read enough of it to understand the shape, the hand gesture toward the elevators, the upward gesture, then the other gesture, the one she recognized because people made it when they were explaining that someone was no longer present. The someone is gone gesture. The Admiral's head turned. His eyes swept the lobby with the automatic precision of someone who'd learned to locate everything in a room before he'd finished walking into it, and they landed on Emily with a directness that made her want to take a step backward, except that she didn't, because she'd also learned some things. He said something to Vogel without looking away from her. Vogel turned. His expression when he saw her did something complicated. The uncertainty shifted into something that looked, briefly, before he controlled it, like genuine discomfort. The Admiral crossed the lobby toward her. Emily held the cardboard box and waited. He stopped 3 feet away. Up close, she could read his insignia clearly, and she revised her read upward. Vice Admiral. She had a moment of thinking, of course, in a way that didn't entirely make sense. Emily Carter, he said. Not a question. Yes, sir. He looked at the cardboard box, then at her badgeless lanyard, which was just a lanyard now. Something moved across his face that she couldn't immediately name. I'm Vice Admiral Raymond Stokes, he said. Naval Special Operations Command. She waited. We've been looking for you for 3 days. I've been at work, she said. He glanced at the box again. Not anymore, it appears. No, sir, not anymore. Behind him, Vogel had drifted closer in the way that administrators drifted toward things that might require his presence, close enough to insert himself and far enough to retreat. He said, Admiral, if there's been some misunderstanding about Miss Carter's status. Stokes turned. Vogel stopped. The Admiral said, Dr. Vogel. I'm the director of Dr. Vogel. The Vice Admiral's voice was the kind of even that was actually very far from even. You fired this woman today. Vogel's jaw did something. There were documented policy violations that necessitated she sutured a veteran's arm. A pause. The scope of practice regulations, Stokes said, his voice staying exactly at that same unnerving level, that you cited against a woman who has sutured wounds in moving vehicles, in zero visibility, under fire, and on 3 continents. He turned back to Emily. Ms. Carter, you can put the box down. She looked at him. I said you can put it down. She set it on the floor beside her. Stokes looked at her with something that was not quite satisfaction and not quite apology, but lived somewhere in the complicated territory between. We have a situation, he said, and we specifically need you. Around them, the lobby had gone quiet in the particular way that institutional spaces went quiet when something was happening that everyone understood they should witness and not interrupt. Mrs. Brandt at the information desk wasn't pretending to look at her computer anymore. The security guard by the main doors had stopped his patrol. 3 people in waiting room chairs were looking. Vogel said, I'm going to need to understand what authority you have to... Stokes looked at him. Just looked at him. Didn't say anything. The look lasted approximately 3 seconds. Vogel stopped talking. The man you admitted to Base 6 today, Stokes said to Emily. Colonel Warren Hale, U.S. Army, retired. He came to this hospital specifically. Something settled in Emily's chest that she couldn't immediately identify. He doesn't say much. That's always been the case. A brief shift in Stokes's expression. He's a stubborn old man who was willing to sit in a parking lot waiting room bleeding for an hour because he wanted to make sure he found you first. Emily was quiet for a moment. Found me? He's been looking for you too. Different reasons. Stokes's voice dropped slightly, not for privacy. There was no real privacy here, but for weight. We have an operator in critical condition aboard the USS Declan. He was brought in 4 hours ago from a classified field operation, and he's been asking for you since he regained consciousness, specifically and repeatedly. Emily felt something cold move through her that wasn't fear. She'd been numb to fear for a long time. This was different. This was the sound of a door she'd closed very carefully, from the inside, opening from the outside. What's the operator's name? She asked. Stokes held her gaze. He wasn't the kind of man who looked away from things. Captain Logan Reed. The lobby sound went distant. The institutional hum of the HVAC, the murmur of the waiting room, Vogel's presence behind and to the left, all of it went to a background frequency while that name landed. Logan Reed had been dead for 6 years. She had watched the casualty report. She had read it 3 times, and then she had folded it into quarters and put it in the bottom of a lockbox in her closet, and she had not opened the lockbox since, but she could still tell you exactly which shelf the lockbox was on and exactly what she had felt when she'd first read the name. "That's not possible," she said. Her voice came out flat and professional, which was not how it felt from the inside, but she'd trained the outside a long time ago. "No," Stokes agreed. "It's not. And yet..." She looked at him. "He needs you, Miss Carter. And I mean that in a medical sense, immediately, and also in several other senses that there isn't time to explain in this lobby." He glanced up, toward the roof. "The aircraft is waiting." Behind her, somewhere in the hospital, a monitor alarmed and was silenced. The building breathed its institutional breath. Vogel made a sound that was the beginning of another sentence. Emily didn't look back at him. She didn't look back at the cardboard box either, the pen and the hair tie, and 18 months of a life she'd constructed carefully out of ordinary materials, built to look like a person who had simply always been a nurse in a medium-sized hospital in a city called Riverton. Nothing else, nothing before, nothing worth explaining. She looked at Stokes. "Let me change out of these scrubs," she said. She didn't actually change. She didn't have anything to change into. She went to the locker room because she needed 30 seconds that were hers, and she stood in front of the row of metal doors and breathed in the smell of antiseptic and rubber soles and the particular stale air quality of a room that saw a lot of shift changes. And she put her hands against the cold metal of a locker door and held them there. Logan Reed. She had last seen him in the kind of dark that had its own weight. She had been kneeling in dirt, and she had been doing what she knew how to do with both hands, while the world was very loud around her. And she had made a decision, the kind of decision that a person who goes on to live a normal life never has to make. And the decision had cost something she'd never finished accounting for. She had walked away from that accounting. She had walked a long way. Riverton, the apartment, the job, the 18 months of being nobody's Iron Wolf, just Emily Carter, who sutured things too well for a floor nurse and didn't talk much about her history, and took the night shifts because the nights were easier for her than they were for other people. She had walked all of that distance, and Logan Reed had somehow walked to the other end of it, alive. She straightened up. She pulled the photograph out of her scrub pocket, the 4 of them in the desert, the impossible grin, and she looked at it for longer than a second this time. Long enough. Then she put it back. She walked back out to the lobby. Stokes was exactly where she'd left him. Vogel had retreated to a distance that allowed him to be present without being directly involved, which was where he was most comfortable. Stokes fell into step beside her as she moved toward the elevator. "The situation aboard the Declan is critical," he said quietly. "He's been stable for approximately 90 minutes, but the surgical team is out of their depth, and he knows it, and he's refusing to let them proceed without you." "Refusing to let them," Emily said. "He pulled the IV line twice." The Admiral's voice was almost dry. "They had to sedate him lightly. He came back up through the sedation and asked for you again." She punched the elevator button. "What are his injuries?" "Blast trauma, primary. Penetrating shrapnel, right thoracic cavity. Hemo-pneumo that they partially drained. Vascular involvement that they haven't. They need someone with field experience who knows. How long is the flight to the Declan?" 43 minutes. She did the math in her head. The kind of math she'd been told she'd never need again. The math she'd done standing in a field with a bag of supplies and a flashlight and the sound of people yelling. The math that didn't ever entirely leave you no matter how many mundane days you stacked on top of it. "He might not have 43 minutes, she said. "I know." The elevator opened. She got in. The rooftop was cold and loud, and the helicopter was exactly where she'd known it would be, rotors turning at ready speed. The pilot watching her cross the roof with the patient attention of someone who had been told they were waiting for a specific person and was now confirming the identification. The escorts fell in around her in that practiced geometry. She climbed through the door closed. The helicopter lifted, and Riverton fell away below. The hospital roof, the parking lot with her car in it, the box with the pen and the hair tie, the locker room, the 18 months. all of it shrinking to a flat geometry as the aircraft banked north and the city became a pattern, and then the pattern became the edge of things. She looked at her hands. They were steady. They'd always been steady under pressure. That was the other thing she hadn't been able to unlearn, the thing that predated the nursing degree by years, and had actually made her very good at the nursing degree if anyone had ever wanted to look at where the skill actually came from. Stokes sat across from her, and he was looking at her the way Command looked at assets, with a particular mixture of respect and calculus. And she met the look evenly. "You said he asked for me by name," she said, raising her voice over the rotor noise. "By your name," Stokes confirmed. "And by the other one." She waited. "Iron Wolf," he said. He said it about 11 times before they got the sedation in. She turned to look out the window. The city was gone. Below them was the flat spread of the coastal approach, green-gray and indifferent, and ahead somewhere was the Atlantic and a ship and a man who should not be alive according to any account she'd been given. Iron Wolf, she thought. The name she'd worn in a different life, in different clothes, with different stakes. The name that had gone into the lockbox with the casualty report. She had been Emily Carter for 4 years. Below the aircraft, the ocean started. It stretched out without apology, and somewhere on it, a man who knew her real name was dying. The helicopter flew on. She almost didn't hear it over the rotor noise. The radio, the aircraft communication system, not a personal device, crackled once and then resolved into a voice that came through the static with the particular quality of someone speaking carefully to conserve strength. The transmission was short, 7 words. Iron Wolf. Then, after a breath that she could hear even through the interference, "Help me." Stokes's hand went to the radio panel immediately, running a confirmation check, talking to the communications operator on the other end in the clipped shorthand of people accustomed to bad news transmissions. Emily watched him, and she knew from the way his hand moved, from the way his jaw set, that what she'd heard was real. That was not Logan. Logan had asked for her by name, through sedation, 11 times. She knew what Logan's voice sounded like. She had the recording of it in the lockbox of her memory, clear as day. That voice on the radio was not Logan's. Stokes turned to her, and he had the expression of a man recalibrating. "There's a second survivor," he said. The rotors beat. The ocean spread out below. Emily Carter, Iron Wolf, looked at him and said nothing, because there was nothing to say until she knew the name. But she already felt the shape of it, the way you felt a word before you heard it, and when Stokes confirmed the transmission and read her the identification number and the name attached to it, she felt the 4 years she'd constructed very carefully begin to unmake themselves at the seams. Mason Drake. The name arrived the way bad news always did, not loudly, not with ceremony, but with a quiet weight that settled into the chest and stayed there. Stokes read it from the transmission confirmation and watched Emily's face, and she could feel him watching, which meant she kept her face at the level she needed it. Mason Drake had been to her right in the photograph. The idiot grin, the arm over her shoulder. She had also read his name in the casualty report. She had read it second, after Logan's, and the second reading had been somehow worse because by then she'd understood what kind of document she was holding. "Where is he?" she asked. "Separate location aboard the Declan. He came in 2 hours after Reed, different extraction team." Stokes paused. "His injuries are less critical, but he has sustained neurological involvement. They're not certain yet." She filed that without reacting to it. Neurological involvement was a wide category. She would know more when she could see him. "You knew him," Stokes said. It wasn't a question. "I knew both of them. From Kharkov Valley." The helicopter hit a pocket of turbulence and adjusted, the pilot making the correction automatically. Emily felt the shift in her stomach and breathed through it. "You've done your reading," she said. 3 days of it," he said. "Everything that wasn't classified above my clearance level, and then I called in 2 favors to get above that." He leaned forward slightly, elbows on his knees. "Ms. Carter, Emily, I want to be straightforward with you about something. When we started looking for you, we knew your name and your general history. We did not know the full scope of what happened in that valley. Some of what we found was redacted. Some of it was simply gone." She looked at him. "The after-action reports for Kharkov have significant gaps," he said. "And in those gaps are the names of the people who were supposed to die and didn't. Reed and Drake, specifically. She turned back to the window. The ocean below was getting darker as the afternoon aged, losing the greenish coastal quality and going properly gray-blue. "There were 6 people in that valley," she said, and her voice was matter-of-fact the way voices were when they'd told a story to themselves enough times that the emotion had worn smooth. 4 of us went in for the primary objective. 2 were already on the ground as advance. When the situation changed, she stopped. The casualty report said 4 dead, 2 unaccounted. 2 unaccounted, Stokes repeated carefully, not dead. I read it as dead. Everyone read it as dead, unaccounted in that context. I know what it usually means. He was quiet for a moment. I think someone wanted it read that way. She sat with that. Someone had wanted Logan and Mason read as dead. Someone had written a report that used language carefully enough to be technically accurate while being functionally misleading. She'd carried that misread for 6 years, and the weight of it, the specific weight of believing she had been the last person to see 2 men alive and that the scene had not been enough, that weight had been the original architectural feature around which she'd built the apartment and the nursing job and the whole careful, ordinary life. The helicopter banked and she saw it. The USS Declan on the water below, smaller than she expected from this height, and then suddenly the right size as they descended. A carrier. Long gray deck, the white of the landing markers, the controlled activity of a ship that was doing several things at once. "How much of the crew knows why I'm here?" she asked. "Medical staff, command staff, that's it? Does the surgical team know my background?" "They know enough." He looked at her steadily. "They know you're the one Reed asked for. They know you have field experience. The full picture. That's going to land differently when they see you walk in." She understood what he meant. She was dressed in scrubs from a hospital that had just fired her, carrying no equipment, with a cardboard box of personal effects that she'd left in a lobby 40 minutes ago. She did not look like someone's answer to a critical surgical situation. She'd looked wrong before. She'd gotten used to the adjustment period. The helicopter set down on the deck with a controlled thud, and the rotors began winding down, and the door opened and she stepped out into the salt air and the organized noise of a functioning carrier, and she walked toward the island structure with Stokes 2 paces behind her and the escorts on the perimeter, and she did not look impressive, and she knew it, and that was fine. The medical bay was 2 levels below the flight deck. She followed Stokes through corridors that had the particular efficient geometry of military ships, everything placed with purpose, nothing wasted, the walls close enough that 2 people walking side by side had to negotiate it, and she cataloged everything without appearing to. Width of the passageways, location of emergency stations, the sound of the ship, which was its own language. The Declan was moving at low speed, holding position, the engine vibration a background frequency underfoot. She heard the medical bay before she reached it. Voices, the particular acoustic quality of a room under controlled tension, where people were being careful about what they said. The door opened and she walked in. There were 4 of them. A Navy surgeon named Brandt, she got the name from his scrubs, who was maybe 45 and had the look of someone who had been awake too long and was making decisions he wasn't comfortable with. 2 surgical nurses moving around a monitoring station, and a younger officer in the corner who was clearly there in an administrative capacity and looked like he wanted to be somewhere else. In the center of the bay, on a surgical table with the rail up, was Logan Reed. She'd prepared herself for the difference between the photograph and the present, and she'd prepared herself wrong. The mathematical gap between 28 and 34 was just numbers. The physical gap was something else. He was lean in a way that suggested recent weight loss, and there was a grayness under his skin color that was both the current blood loss and something older, something that had been living in him for a while. But his face, the underlying architecture of it, was the same face. She knew it from the desert photograph, and she knew it from before the photograph, and she knew it in the way you knew faces that had been part of the texture of a significant period of your life. His eyes were closed. The light sedation was holding, but Brandt looked up when she walked in with an expression that said it might not hold long. "Carter?" Brandt said. Not rude exactly, uncertain. "Yes." She moved toward the monitoring station. "What's his current status?" Brandt looked at Stokes. Stokes nodded once. Brandt pulled up the chart. Blast injury, primary. We have penetrating shrapnel in the right chest. 2 fragments identified on imaging, 1 we got, 1 is still in there near the posterior segment of the right lower lobe. Hemopneumothorax, right side. We placed the chest tube about, he checked the time, 3 hours ago. Output has slowed, but not stopped. His pressure's been hovering at 92/60 for the last hour, and we can't get it higher. Suspected vascular involvement, possibly intercostal artery, possibly something worse. Emily looked at the monitor. Oxygen saturation at 93, heart rate 88, pressure exactly where Brandt had said, and not moving. You need to go in, she said. We're aware of that. He won't. Brandt stopped. When he's under light sedation, he becomes agitated. He's pulled the IV line twice. He woke up the last time asking for... I know what he was asking for. She leaned over the rail and looked at Logan's face. Reed. Her voice was even, clinical, close. Reed. The eyelids moved. Reed, I'm here. His eyes opened. The pupils contracted appropriately. That was one good thing. And then focused with the particular effort of someone working through pharmacology to get to a specific place. He found her face. Something happened in his expression that was not dramatic. It was the opposite of dramatic. It was the quiet way a person's face changed when they'd been tensed against something for a long time and the something finally resolved. Carter, he said. His voice was a wreck, dry and rough and barely there. Yeah, she said. I'm actually here. Stop talking. Let Brandt do the surgery. He looked at her. His eyes were doing the thing that eyes did when a person was in significant pain and trying to process several things at once. How did they... Later, she said. Reed, listen to me. Brandt is going to put you under properly and go in and get the fragment. Your pressure is low, and that's going to keep being a problem until he does. Do you understand? A pause. He was thinking about whether to argue. She could see him thinking about it. You'll be here, he said. I'll be right here. He looked at Brandt, then back at her. Okay, he said, and he said it the way someone said okay when they meant only because you said so. And then he closed his eyes. Brandt let out a breath that had clearly been waiting. We need to go in right now, Emily said, turning to him. He's compensating, but the margin is getting thin. I agree, but I need to be honest with you. Our surgical team isn't... Brandt chose words carefully. We handle standard trauma. The positioning of the second fragment, the vascular involvement. I've seen worse positioning, she said. He looked at her. Really looked. The way Stokes had looked on the helicopter map. Doing the math, recalibrating. What's your surgery background, he said. Not challenging, actually asking. Field surgical assist, 4 years, thoracic and abdominal primarily. I've managed chest trauma in resource-limited environments. She paused. I know this particular man's physiology in a field context. I know how he responds to anesthesia and how his pressure behaves under stress. That information is relevant. Brandt was quiet for about 4 seconds. Scrub in, he said. The surgery took 91 minutes. She was not the surgeon. Brandt was the surgeon, and he was good, better than he'd given himself credit for, which was a thing Emily had noticed about good surgeons under pressure. They undersold themselves going in, and then you watched their hands and understood they'd been being honest rather than modest. She was across from him, managing retraction and suction and handing him what he needed before he had to ask for it. And she called his attention to the intercostal bleeding pattern at the 30-minute mark when she saw something in how the field looked that told her where the trouble was. And she was right, and Brandt found the compromised vessel and dealt with it with a tidiness that she respected. The second fragment came out at minute 64. It was smaller than the imaging had suggested, which was good, and it had been close enough to the arterial territory that its specific trajectory had probably saved Logan's life. 2 millimeters in any other direction would have been a conversation they weren't having because he wouldn't have made it to the ship. His pressure came up to 105/70 within 12 minutes of the closure. She watched the number climb and felt something unclench in her thoracic cavity that she hadn't consciously been holding. Brandt straightened and rolled his neck. That was... He stopped. Yeah, she said. You called the bleed at exactly the right moment. The field pooling pattern. You would have found it. Maybe. He looked at her across the surgical table. Maybe not in time. He started pulling off his gloves. Where did you train? She told him the first part of the answer, the nursing degree, the hospital posting, and left out the second part. He looked like he understood there was a second part and chose not to push on it. Logan was moved to recovery. Emily pulled off her gown and scrubbed out and stood at the sink with water running over her hands for a moment longer than strictly necessary, the way she sometimes did when she needed a transition between one state and another. Stokes appeared in the doorway. Mason Drake, she said before he could open his mouth. He led her 3 doors down. Mason was awake. That was the first and most significant difference between him and Logan right now. Mason was sitting up in the bed with his back against the raised rail and his eyes open and tracking, which meant his neurological status was better than involvement had led her to expect. He was thinner than Logan, if that was possible. He'd grown a beard that didn't suit him. He had a bandaged left forearm and something around his ribs that she identified as wrapping for at minimum 2 cracked ribs, and he had the look of a man who had been through a significant amount and had decided not to be interesting about it. When he saw her, he did the thing that Logan had done, but louder, because Mason had always been louder. His face cracked open. "Carter," he said, and his voice broke on it, just slightly, just enough. "Drake," she said. She came to stand beside the bed and she looked at him carefully. The eyes, the responsiveness, the way he was holding his head. And while she was doing that, he grabbed her wrist. Not hard, just held it. "I knew you'd come," he said. "I didn't know you were alive," she said. His grip tightened slightly. "I know." She let him hold her wrist for a moment because he needed to and because she understood the need. Then she put her other hand over his and removed his grip gently. "Let me look at you properly. Then we can talk." The neurological involvement turned out to be moderate. A concussive episode from the extraction, some short-term memory disruption, and a sensitivity to light that the ship's medical officer had already started treating. His vitals were better than Logan's had been because he hadn't sustained the thoracic injury. He was going to have a significant recovery process, but he was present. He was tracking. He was Mason. She sat in the chair beside his bed when she'd finished the assessment, and she didn't say anything for a moment because she was processing the fact of him, the alive fact of him, the 6-year gap between the casualty report and this room, and what lived in that gap. "You have questions," he said. "I have about 40. "Yeah." He shifted against the rail. "I'd start with the obvious one. The casualty report said you were dead." "The casualty report was wrong. Or it was written to be wrong. We've spent a lot of time figuring out which one." He looked at her. "You believed it." "Of course I believed it. I read your name." "I know. Logan figured that out eventually. That you'd gone. That you believed we were gone." He stopped. "We tried to find you. After. It took longer than it should have because you'd—" "I know what I did," she said. She'd buried herself. That was the accurate description. She had taken Emily Carter and compressed her into the smallest possible footprint. No social media, a new city, a new credential set, a job that would not require her to use her actual skills at any level that might flag her in a system somewhere. She had made herself invisible, because invisible was the only thing that felt safe after Kharkov Valley, after the report, after the specific way the military had handled the aftermath in a manner she had understood to be a message. "Someone didn't want us found," Mason said. "Either of us. The redactions in the after-action report, there were things in there that, if they came out, would be a problem for some people." She looked at him. "What kind of people?" "The kind that have the authority to write casualty reports and the motivation to write them a specific way." He held her gaze. "The operation in that valley wasn't what we were briefed. You know that. You knew it going in. You were the one who said something was wrong with the intelligence package." She had said that. 3 days before the operation, looking at the targeting data and the route plan and the communications intercepts that were supposed to justify the whole thing, she had flagged to her unit commander that the picture didn't add up. She had written it in a formal report. Nothing had changed. She had still gone in because her people were going in. "The intelligence failure was deliberate," Mason said. She was quiet. "It wasn't a failure," he continued. "Someone fed us bad information. On purpose. The unit went into that valley because someone needed us in that valley. And what happened there? The casualties? It wasn't an accident. And there are people who have been aware of that for 6 years and have been working very hard to ensure it stays buried. Outside the room, the ship hummed. Somewhere above them, the flight deck was active. She could feel the distant percussion of operations through the hull. Logan knows all of this, she said. Logan has spent the last 2 years building a case. Mason's voice was careful, measured. He's been working with someone on the inside. That's what the current operation was about. Not a field objective, a retrieval, documents, the kind that don't come out through official channels. The operation that got him injured. He almost didn't make it to the extraction point. Mason's jaw tightened. Someone knew the retrieval was happening. Someone warned the other side. She felt the cold thing move through her again. There's still someone in the network. Yes? She sat with that. The ship's hum. The light that was slightly too bright for Mason's eyes and that he was tolerating without complaint. The bandaging on his forearm. The 6 years he'd been alive while she'd been treating him as a weight to carry. You said Logan has been building a case, she said. The documents he retrieved, I don't know if he got them before the injury. I don't know what he has. Mason looked toward the door. But whatever he has, and whatever I have from the 2 years before we reconnected on the current op, it needs to get to someone who can't be touched. And that's... He stopped. That's complicated, she said. That's very complicated, because the person we were going to bring it to... He stopped again. This time it wasn't caution. He looked genuinely uncertain, which was a thing she'd seen from Mason Drake exactly once in the years she'd known him, on the night before the Kharkov operation. We were bringing it to Stokes. She turned to look at the door. We trusted Stokes, Mason said. Logan trusted him. He's the reason we ended up on the Declan, the reason the extraction was arranged. But the leak that burned Logan's retrieval, he let her finish the sentence herself. The leak had come from somewhere inside the chain that had arranged the extraction. Stokes was at the end of that chain. She stood up. Her legs were steady, and her hands were steady, and somewhere behind her sternum something was doing something complex and unpleasant that she'd deal with later. Does Logan know you're concerned about Stokes? She asked. We haven't talked since I got here. They won't let me in his room until he's post-surgery stable. She moved to the door, her hand on the frame. Carter. Mason's voice. She stopped. I could be wrong, he said. About Stokes. It could be someone else in the chain. I've been running on bad sleep and a head injury for 3 days, and my judgment has a margin of error right now. She looked back at him. How big a margin? He thought about it honestly. Not big enough to bet someone's life on, he said, but big enough to be careful. She nodded once. She walked out into the corridor, and Stokes was standing 12 feet away, looking at his phone, and he looked up when she appeared, and his expression was exactly what it had been. Attentive, direct, the manner of a man who had not hidden anything from her, which could mean he hadn't, or it could mean he was very good at his job. How's Drake? He said. Stable, cognitive function intact. She kept her voice at its normal register. He needs rest and a neurological evaluation in the next 24 hours. Stokes nodded. And Logan? Out of surgery? Pressure is up. Brant did good work. Good. He looked at her with something that was almost relief, or wanted to be relief. Emily, what Drake told you in there, whatever he... She kept her face at the level she needed it. He told me he was glad to be alive, she said. Stokes held her gaze for a moment. His expression did something she couldn't read, and that in itself was information. A man that readable choosing not to be. Of course, he said. Of course he is. Down the corridor, a door opened. One of Brant's nurses came out and said something to the officer on the far end and turned back in. The ship moved beneath them, a long, slow roll that nobody on a carrier noticed consciously anymore. Emily looked at Stokes and thought about 6 years and casualty reports, and the specific way trust got used as a tool. She thought about Mason's margin of error. She thought about the documents Logan had gone to retrieve, and whether he'd gotten them, and whether they were still somewhere on this ship, and who on this ship knew that. I'd like to check on Logan directly when he's out of recovery, she said. Of course, Stokes said again. She held his gaze one more second. In Logan's room, in whatever pocket or bag had come with him from the field, there might be something that answered the question she was now carrying, or there might be nothing, or Logan might wake up and tell her she'd misunderstood everything. But she had learned in a valley 6 years ago the cost of assuming the picture in front of her was the whole picture. She wasn't going to make that mistake again. The recovery room had one chair and a monitoring station, and the particular quality of silence that existed in rooms where people were working very hard at staying alive without anyone having to say so. Logan was out of anesthesia in the technical sense. His eyes were open, tracking the ceiling, but he wasn't back yet in the way that mattered. Emily sat in the chair and watched the monitor and waited. She was good at waiting. She'd spent 4 years building a life that was mostly waiting, though she hadn't recognized it as that until now. Brant checked in at the 20-minute mark, looked at the readings, and said good in the way surgeons said good when they meant better than I feared. Then he left. The nurse on rotation was a petty officer named Reyes, who moved quietly and checked Logan's lines with the efficiency of someone who'd done the rotation enough times that it was in her hands rather than her head. Emily was watching the door as much as she was watching Logan. The corridor outside had a rhythm to it. Footsteps, voices, the particular acoustic of a ship passageway where sound carried and then cut off. She'd been mapping it since she sat down. Stokes had come by once, looked through the small window in the door, and continued walking. Whether that was normal or calculated, she couldn't determine yet. What she knew, Logan had gone into a field operation to retrieve documents. He'd been injured before or during extraction. He'd been brought aboard the Declan by an operation that Stokes had arranged. Someone had leaked the retrieval timeline to the opposing side. Mason wasn't certain Stokes was the leak, but wasn't certain he wasn't. And Mason's uncertainty was specific enough to mean something, what she needed to talk to Logan before anyone else did. Carter? His voice was rough with disuse and anesthesia. She shifted forward in the chair. Yeah, she said. Still here. Logan turned his head toward her slowly. The effort it cost him was visible in the set of his jaw. He looked at her for a moment with eyes that were doing the work of reorienting, where he was, what had happened, in what order, and she let him do it without rushing him. Surgery's done, she said. Brant got the fragment. Your pressure's up. He processed that. How long was I under? About 90 minutes. Drake. Not a question, really. More like a word he needed to say to check its weight. Stable. I saw him before they brought you out of recovery. He's awake and talking. The neurological symptoms are manageable. She paused. He told me things. Logan's eyes sharpened. That was the anesthesia clearing. Whatever had been soft and unfocused went direct. How much? He said. Enough. She held his gaze. The documents, Logan. The retrieval. Did you get them? A pause that lasted one breath too long. Some of them, he said. Where are they? He looked at the ceiling, then back at her. He was doing the same calculation she'd been doing in the chair. Who to trust? How far? On what information? She understood the calculation. She'd been running it herself since Mason had said Stokes's name with that particular hesitation. Inside pocket of my field jacket, he said. They would have cut it off me in triage. She looked at Reyes. Is there a bag with his clothes from intake? Reyes opened a lower cabinet without being asked. Standard procedure. Personal effects bagged and stored. She set the bag on the edge of the monitoring station and went back to her chart. Emily opened the bag. The field jacket was there, cut up the front seam from triage, still carrying the particular smell of field operations. Sweat, dirt, something chemical she didn't identify immediately. She found the inside pocket. Her fingers closed on something thin and hard, a sealed, waterproof envelope, the kind that came with tactical gear, designed to survive submersion. She held it. Logan was watching her. The full set was in 4 locations, he said. I got to 2 before the situation changed. What's in there is partial. His voice was getting stronger as the anesthesia metabolized, gaining its edges back. But it's enough. If it gets to the right people, it's enough. Mason said you were bringing it to Stokes. That was the plan. Is it still the plan? Another pause. Longer this time. She watched him work through it. Whatever he knew, whatever he suspected, whatever the operation had revealed about the shape of the leak. No, he said finally. It's not. She put the envelope in the front pocket of her scrubs. It fit without a visible outline. She smoothed the fabric once. Who then? She said. There's an investigator, Logan said. Naval Criminal Investigative Service. Her name is Petra Voss. She's been running a parallel inquiry for 8 months, separately from command. She doesn't report to anyone in the operational chain. He stopped to breathe. The movement of his chest was still careful, still feeling out the new architecture of his thoracic cavity post-surgery. She's the reason I know the intelligence failure was deliberate. She came to me. She'd been building from the outside, and she needed someone with direct field knowledge of Kharkov Valley. You've been in contact with an NCIS investigator for 8 months, and you're only now bringing documents out. The documents she needed don't exist in any database. They were never digitized. Whoever structured the Kharkov intelligence package was careful. Everything traceable was cleaned. What's left are physical communications records from a specific operations planning archive, and those records were moved twice in the last 2 years to keep them inaccessible. His voice was matter-of-fact, the way it was when he was briefing, the way she remembered it. I finally got access to the archive 3 weeks ago. The operation that went wrong was the retrieval. How do I reach Voss? She gave me a contact protocol. If I didn't check in within 72 hours of extraction, she was instructed to begin the next phase of the inquiry independently. She won't wait for me to surface. He looked at Emily with the directness that had always been his particular quality. Not aggression, just the absence of deflection. But the documents I have would accelerate everything. Get them to her before Stokes understands what you're carrying. The monitor beeped a standard interval tone. Reyes looked up, looked at the numbers, looked back down. Logan's pressure was holding at 108/72. He's going to figure it out, Emily said. When you're stable enough to talk to command, they'll debrief you on the retrieval. The question of what you recovered will come up. I know. Logan closed his eyes for a moment. Not sleep, just conservation. That's why it needs to move fast. She stood up. Her hand went briefly to the front of her scrubs, and then she stopped it from going there, because that was exactly the kind of gesture that told people where something was. Rest, she said. Don't tell anyone else what you told me. He opened his eyes, looked at her with something that was complicated and old and had survived 6 years of geography and silence between them. Carter has, he said. I know, she said. She didn't know exactly what he was going to say, but she knew the shape of it. Something about being sorry, or something about being glad, or something that occupied the territory between those two things. She didn't have room for it right now. Later, when this is done, he nodded. It cost him something. She could see that. She walked out. The corridor was clear in both directions. She moved toward the communication center, which she'd noted on the walk down from the flight deck. Third passageway, port side. The door with 2 cipher locks and a duty officer visible through the internal window. She didn't have access. She needed access, or she needed someone who did. And she needed to get there before Stokes made a check on Logan's room and found the field jacket bag lighter than expected. She was calculating this when she turned a corner and nearly walked into Colonel Warren Hale. He was in a wheelchair. His left arm in a proper bandage now, the neat edge of hospital dressing rather than a handkerchief, being pushed by a young Navy corpsman who looked startled by the near collision. Hale himself didn't look startled. He looked at her with the same flat, patient look he'd had in the ER waiting room. You're the one who stitched my arm, he said. Yes, sir, she said. Good work. He looked at her face, then at the way she was standing, which she immediately adjusted, though she suspected he'd already read it. You look like someone who needs to make a call and can't get to a phone. She looked at the corpsman. Hale said, Marcus, go get me a coffee, the good kind from the officer's mess. Marcus looked uncertain. He was clearly there for medical supervision, and then the colonel turned the wheelchair half an inch in his direction, and Marcus decided the coffee sounded fine. When he was gone, Hale looked at Emily. You know who I am, she said. I know what you did in Kharkov Valley, he said. I was on the oversight board that reviewed the after-action report, the classified version, not the one that got filed. He said it without drama, just fact. I've known for 6 years that the report was wrong. I spent 4 years trying to find you because I thought you deserved to know that what happened in that valley was not your fault and was not your failure. And then I spent 2 more years losing the trail." He paused. "I sat in an ER waiting room for 47 minutes because I knew if I walked up to the desk and said my name, you'd disappear before I could talk to you." She looked at him. "He was bleeding on purpose," she said. "The laceration." He almost smiled. It was a tight, controlled almost. "It was a real laceration. I'm not that dramatic, but I did wait longer than I should have before seeking attention." She thought about the handkerchief gone dark red, the particular stillness of him, the way he'd looked at her badge first, then her face. "You need to make a communication," he said, "not through official channels." She studied him for a moment. The calculation again, trust, how far, on what basis. But the basis here was different. Hale had nothing to gain from her. He'd been bled for her. He'd found her in a hospital lobby in a city she had chosen specifically for its invisibility. "NCIS," she said, "investigator named Petra Voss." Something shifted in his expression. Recognition. "I know Voss," he said. "She briefed me 8 months ago. I'm part of the parallel inquiry." He looked at her steadily. "I've been her eyes inside the command structure. That's why I'm on this ship, not because of my arm." The almost smile again, darker. Though the arm helped with timing, the ship rolled slightly. Emily put her hand against the passageway wall without thinking. "I have the documents from Logan's retrieval," she said. "Partial, but enough. They need to get to Voss before Stokes understands they exist." Hale's expression didn't change dramatically, but his eyes went through several calculations in rapid sequence. She watched it happen. "Stokes," he said. "I don't know for certain," she said. "Mason isn't certain. But the leak that burned Logan's retrieval came from inside the extraction chain, and Stokes is at the top of that chain." "Or Stokes is the target," Hale said. "Someone wanted the retrieval burned and wanted it to look like it came from inside his chain to neutralize him." She hadn't thought of it from that direction. She thought of it now. It was a viable construction. If the people the documents implicated knew about the parallel inquiry, they might frame the leak to eliminate Stokes as a functional ally. "Can you get word to Voss?" she said. "I have a direct line, encrypted, outside the ship's communication system." He looked at the pocket of her scrubs, not at the shape of the envelope, just at the pocket. He was being careful about that. "It'll take 90 minutes to arrange a secure physical handoff. She's not far. She's been positioned nearby for the last week, waiting on Logan's extraction." 90 minutes. She thought about Logan's pressure, stable but not robust. She thought about Stokes in the corridor, doing the calculation she was also doing. She thought about the envelope in her pocket and what Logan had said. Whoever structured the Kharkov intelligence package was careful. Careful people, when they realized their documents were moving, moved fast. "Do it," she said. Hale nodded, reached into the armrest of the wheelchair with the practiced gesture of someone who'd planned for this specific moment, and produced a small device, not a standard Navy communication piece. Something that had been brought aboard outside the manifest. She was going to ask where Marcus was going to be for the next 90 minutes when the ship's internal announcement system activated. It wasn't a general announcement. It was a command-level tone. 2 specific notes that meant all senior personnel to the command deck. Emily had heard it once in training and didn't remember the details, but her body remembered the notes. Hale heard it too. His expression went flat in the specific way of someone who understood that a timeline had just changed. "That's not a drill," he said. She already knew. She moved back toward the medical bay at a pace that was below running, but not by much, because running on a ship drew attention, and attention was the thing she couldn't afford. She needed Logan's room. She needed to know he was secure, that nobody had moved on him while she was in the corridor. She was 12 feet from the medical bay door when it opened. Stokes came out. He saw her immediately. There was nowhere to be that wasn't directly in front of him. And for one beat, she watched his face run through its own sequence. She couldn't read all of it. She read enough. "Emily," he said, "Vice Admiral." She kept walking, planning to go around him into the room, and he moved, not blocking her, not physically, but repositioning so that the conversation had a direction. "Logan is fine," he said. "I just checked with Reyes. His stats are stable." He paused. "I need to talk to you." "I should check on him myself." Emily. His voice dropped. Not threatening, urgent in a specific way that didn't feel performed. I know about Voss. She stopped. I know Mason told you to be careful about me, Stokes said, and his voice had lost the command register entirely. It was lower than that. It was the voice of someone saying something they couldn't say loudly. He's right to be careful, but not about me. She looked at him. I've been working with Voss for 14 months, he said. Longer than Hale. I'm the reason Voss has the access she has. I opened 3 classified archives for her inquiry at significant personal risk, and I have been very careful not to appear to be cooperating with her for exactly the reason that Mason identified. He held her gaze. If I'm the leak, then the documents Logan retrieved are already compromised, and this conversation doesn't matter. But I'm not the leak. And the reason I know that is because I know who is. The announcement system was still cycling. Above them, footsteps on the deck. Senior officers moving toward command. The leak, she said. Who? Lieutenant Commander Ferris, Stokes said. He's on my staff. He's been there for 18 months. He came in through a reassignment that I approved because his file was clean and his references were good, and it took Voss 8 months to find the financial trail that explained why his references were so good. His jaw tightened. He knew about Logan's extraction because I briefed my staff. I couldn't not brief my staff without raising questions, and he burned it. She processed this. That announcement, she said. What triggered it? Something crossed Stokes's face that looked like the beginning of a very bad hour. Ferris is on this ship, he said, and 20 minutes ago, he accessed the medical bay security system. She was already moving. She went around Stokes, through the medical bay door, and Reyes looked up from the monitoring station with an expression that said something had just happened and she didn't know what. The chair beside Logan's bed was empty. The waterproof envelope, she checked her pocket, was still there. Logan was in the bed, awake, eyes tracking her with an alertness that said his anesthesia had fully cleared and that he'd heard something or noticed something in the last several minutes. Someone came in, he said. Navy uniform. He looked at my intake bag. She looked at the bag on the monitoring station. Closed, refolded, but not the way she'd left it. Someone had checked it, found the jacket, found the inside pocket, found it empty. She put her hand in her scrubs pocket. The envelope was there, solid and flat. Stokes appeared in the doorway behind her. Logan looked at him. The look lasted about 2 seconds and covered a significant amount of ground. Ferris checked the bag, Stokes said. He knows it's gone. Logan's hand came up slightly from the bed, not reaching, just a gesture. The documents you have, he said to Emily. There's a second piece, one I didn't mention. She looked at him. I said I got to 2 of the 4 locations, he said. The second location, I found something I wasn't looking for. A list, personnel and operational positions, people inside the current command structure. He stopped to breathe. It's in the envelope. 3rd page, separate fold. I didn't tell Mason because I didn't know yet who on this ship I could trust. She felt the weight of the envelope differently now. A list of names, people currently inside the structure who were part of whatever had been built on the foundation of Kharkov Valley. Not just the past, the present. How many names? She said. Logan looked at her steadily. 11, he said. Somewhere above them, on the command deck, a door opened and closed hard. The ship moved beneath them and she felt it in her knees. Not the regular roll, but a deliberate change in speed. Someone had ordered a course adjustment, someone with the authority to move the ship. She looked at Stokes. His face had gone to a place she couldn't read at all. Raymond, Logan said, and it was the first time she'd heard him use the first name, which told her something about the history between these 2 men that she hadn't been given. Is Ferris on the command deck right now? Stokes's hand went to his radio. The radio was gone. He looked at his belt, the holster where the communication device had been. Empty. The motion had the quality of a man discovering something that changed the shape of the last 10 minutes entirely. Someone had taken it, recently. Close enough that he hadn't noticed. The lights in the medical bay flickered once, then the ship's announcement system activated again, and this time it wasn't the command-level tone. It was something Emily had not heard in training or practice or in any of the years she'd been building a quiet life in Riverton. It was the ship-wide emergency protocol. And it was coming from the command deck, The emergency protocol had 3 tones. Emily counted them automatically, the way she'd been trained to count them. 1 for fire, 2 for flooding, 3 for a security breach at the command level. She heard 3. Stokes looked at his empty holster for exactly 1 more second. Then he became a different version of himself. Not calmer, but more organized, the way people with real command experience responded to the thing they'd been dreading by contracting into function. "Reyes," he said, "lock this bay. Nobody in without my authorization or Admiral Hale's. You understand?" Reyes looked at the door, at Stokes, at Emily. "Yes, sir." "Logan." He crossed to the bed. "Can you sit up?" "Don't need to sit up," Logan said. "Need you to tell me what Ferris has access to on this ship. Command communications, navigational override protocols. He shouldn't have either. His clearance doesn't cover either. But if he's been on my staff for 18 months with a fabricated file, his actual access may be different from his documented access." The lights held steady now. The flickering had been a single event, which meant power systems were intact, which meant whatever Ferris had done or was doing didn't include disabling the ship's primary infrastructure. That was the one piece of information that shaped the geometry of the next few minutes. They had lights, they had medical equipment, they had communication systems that Stokes couldn't currently reach because his radio was gone. "Hale." Emily went back to the door. She cracked it. Reyes made a sound. She looked into the corridor, empty in both directions. She stepped out. Marcus the corpsman was coming back from the officers' mess with a paper cup of coffee, looking confused by the announcement he'd heard and the corridor traffic that had cleared out around him. He stopped when he saw Emily. "Where's Colonel Hale?" she said. "He sent me for coffee." "I know. Where is he now?" Marcus pointed down the corridor. "He said he was going back to his room. I assumed he—" She was already moving. Hale's quarters were 6 doors down on the starboard side. The door was open, which was not how she'd expect to find it. She went through it and the room was empty. Bed, chair, the small desk with the lamp, no Hale. The device he'd shown her in the corridor was gone. He'd taken it, which meant he was already using it. She went back to the medical bay. Stokes was standing with his back to Logan's bed, facing the door, and he looked at her when she came in, and she gave him a small head shake. "Hale's gone. I don't know where." He absorbed that without visible reaction. "Ferris took your radio," she said. "How close did he have to be?" "Within arm's reach." He said it flatly, without embarrassment, which she respected. "There was a briefing 40 minutes ago, command staff only. He was behind me during the summary. He knew then that you were aware of him. He must have. Or he knew that Logan's retrieval had produced something viable and that the window was closing." Stokes looked at Logan. "The ship's course change. That wasn't my order." Logan said, "Where are we heading?" "I don't know. That's the problem." Emily looked at the monitoring station. The ship's navigation feed wasn't displayed there. This was a medical bay, not a bridge. But there was a general status terminal on the wall, the kind that existed in every functional section of a carrier for emergency crew information. She crossed to it and pulled up the basic navigation display. The Declan had changed heading by 31 degrees. The new heading took them away from the coastal position they'd been holding and out into open water. She looked at the course for a moment. Then she understood. "He's moving the ship out of Voss's range," she said. Stokes came to look at the screen. He looked at it for 2 seconds. The physical handoff Hale was arranging, Voss was going to come alongside. The ship had to be within a specific distance for the approach. "Ferris knows about Voss," Logan said from the bed. He'd gotten himself partially upright, arm braced against the rail. Not dramatically, just functionally, the way someone moved when they decided being flat was no longer an option. "He's been on your staff. He knows everything you know." "Including that Voss exists, where she's positioned, and what the handoff plan was," Stokes said. The terminal showed their heading. At this speed, they'd be outside the viable approach range in approximately 35 minutes. "Then we have 35 minutes, Emily said. She took the envelope out of her scrub's pocket. She looked at it. The sealed waterproof casing, the 6 years of consequences inside it. And she thought about the specific problem in front of her, which was the documents needed to reach Voss. Voss was on a vessel that was now falling behind them. Hale had the communication device. and Ferris had apparently decided that moving the entire ship was a simpler solution than trying to intercept Emily in a corridor. That last part told her something important. Ferris had decided the documents were the priority, not the people. Which meant he didn't know exactly what she had. He'd checked the bag, found the pocket empty, and understood the documents had moved. But he didn't know she was carrying them, or he'd have come for her directly. She still had a window. "Your staff," she said to Stokes. "Who else on this ship isn't Ferris?" "Everyone else," he said. "Ferris is one man. One man who's currently operating the command deck without authorization. Who's up there?" "The duty officer is Commander Halsey. She wouldn't—" He stopped. She would not have authorized a course change without flag-level approval. If the ship changed heading, either she was overridden through a system access she couldn't counter, or she doesn't know the change happened. She's a commander on her own ship and she doesn't know the heading changed. It's possible to make navigational adjustments at the system level that don't trigger an immediate bridge alarm if you have the right access credentials. 18 months on my staff. His voice was controlled, but there was something beneath it. The specific anger of a person who'd let someone into a position of trust and been used for it. He had time to learn the system's blind spots. Emily handed the envelope to Stokes. He looked at her. "Hold that," she said. "Don't let it out of your hands." She turned to Reyes. "I need your communication badge." Reyes blinked. "Ma'am, I'm not authorized. You're authorized to assist in a medical emergency. I'm telling you this is one." She held out her hand. "Your comm badge. 10 minutes." Reyes looked at Stokes. Stokes nodded once. Reyes unpinned the badge from her scrub collar and handed it over. Emily walked out. The ship's internal communication system through a standard crew badge had limited function. She could reach any station, any bay, any section, but the communication was not encrypted, and it was logged. Every word would be recorded. That was fine. What she needed right now wasn't secrecy, it was the opposite. She walked to the end of the corridor away from foot traffic, and she keyed the badge. "Commander Halsey," she said. "Bridge." 3 seconds of static. Then, "This is Bridge, Lieutenant Okafor speaking. Who is—" "My name is Emily Carter. I'm a medical consultant currently aboard the Declan under orders from Vice Admiral Stokes. I need Commander Halsey directly. This is a command-level security communication and it is being logged. Please note the time and my name for the record." Another pause. Longer. She could hear the bridge ambient sounds, the low operational hum, a voice in the background. "Miss Carter, this is Commander Halsey." Her voice was even and professional and carried the particular quality of someone who had already been having a difficult 20 minutes and was managing it by being very controlled. "Commander, your ship changed heading approximately 18 minutes ago," Emily said. "Was that change authorized by Vice Admiral Stokes or by you?" A pause. "That information is—" "Commander, this communication is logged. Whatever you tell me becomes part of the record. I'm asking you a direct question. Did you authorize or receive flag-level authorization for the current heading change?" A longer pause. The kind that told Emily the answer was no, and Halsey was deciding how to say it. "The change was processed through the navigational management system," Halsey said carefully. "The authorization code that accompanied it was valid." "Was the authorization code Stokes's?" "I am not able to confirm." "Commander Halsey," Emily's voice stayed even. "Lieutenant Commander Ferris is currently operating without authorization on this ship. Vice Admiral Stokes's personal communication device was taken from him approximately 40 minutes ago. The authorization code that accompanied the heading change may have been obtained through that device." She paused. "I need you to freeze all navigational changes pending direct verbal confirmation from Stokes, and I need you to locate Ferris's current position on the ship." The bridge was quiet for 3 seconds. "Hold," Halsey said. Emily waited in the corridor, listening to the ship's sounds, watching the passageway. A petty officer walked through at the far end and didn't look at her. The engine vibration through the deck was steady, and she tried to feel whether the speed was changing. It wasn't, not yet. "Ms. Carter," Halsey's voice came back. Her register had changed slightly. "Navigational override has been suspended pending flag confirmation. I'm also seeing—" She stopped. Mr. Ferris's access card was used at the communications center 14 minutes ago and has not been logged out. The communications center, third passageway, port side. The door Emily hadn't been able to get through because she didn't have access. He's in communications, Emily said. It appears so. Can you lock him in from the bridge? Another pause. She could hear Halsey talking to someone on the bridge. Short, clipped exchange. The kind of talk that happened when people were moving fast. Ms. Carter, if I lock that section remotely, I need to justify it in the ship's log with a specific security classification. I would need that classification to come from flag level. Stokes is in the medical bay, Bay 3, port side. You can reach him on... She looked at Reyes's badge. The unit number was printed on the back. She read it to Halsey. Connecting now, Halsey said. Stay on the line. The connection went to hold tone. Emily pressed the badge against her collarbone and looked at the ceiling and thought about what Ferris was doing in the communications center. 14 minutes was enough time to do several things. Send a transmission, receive instructions, delete logs, or prepare something that she hadn't anticipated yet. The hold tone ended. Ms. Carter. It was Stokes' voice now, coming through the same channel, which meant Halsey had bridged the connection. I've given Commander Halsey the authorization to lock the communication section. She's doing it now. Has she confirmed Ferris's location? His card is still active in there. He hasn't left. A pause. What he's doing in there, the communication center has external transmission capability. If he's been in there for 14 minutes, he may have already sent something. To who? The people whose names are in those documents. He said it plainly. If they know what Logan retrieved and they know it's aboard this ship, he didn't finish the sentence. He didn't need to. If the people on that list knew their documentation was aboard a carrier in the Atlantic, they had options. They had resources. They had the kind of reach that had kept Kharkov Valley buried for 6 years and kept 2 men listed as unaccounted when they were alive. Get the documents to Voss, Emily said. Whatever it takes, that has to happen. The ship is frozen on heading. Voss is still within range if we return to previous position. But I need someone to reach Hale and confirm the handoff protocol. I'll find Hale, Emily said. She cut the connection and moved. He was in the ship's medical library, of all places, a small room 2 sections aft of the main bay that existed for reference materials and had the particular invisibility of spaces nobody went unless they needed something specific. The door was mostly closed. She pushed it open and Hale was sitting in the corner with the device on his knee, talking quietly into it, and he looked up when she came in with the expression of someone who'd been expecting interruption and had prepared for it. He held up one finger. She waited. She counted 12 seconds. He finished the transmission and looked at her. Voss knows, he said. The handoff is ready. She needs the ship to return to the previous position, and she needs 30 minutes for the approach. The ship's been frozen, Emily said. Stokes is working on returning heading. Ferris is locked in the communications center. Is he? Hale looked at the device. He made a transmission in the last 10 minutes. Voss's team intercepted part of it. They've been monitoring the frequencies he was likely to use. He sent coordinates and a document description to a relay address that Voss has been tracking for 8 months. He looked at her with the flat, patient look. The people on that list know what Logan retrieved. They know it's on this ship. She absorbed that. How long before they can act on it, she said. Voss estimates 90 minutes before any physical response is viable. The people on that list with operational resources are not close. He paused. But that's the physical response. Their other response, political, administrative, the kind that makes evidence disappear from an official chain before it can be formally entered, that moves faster. 90 minutes for the operational threat, less for the institutional one. She went back to the medical bay, moving at the pace just below running, and when she came through the door, Logan was fully upright against the bed rail, not lying down, not resting, sitting with his legs over the side of the bed in a position that Brant would not have approved and that she understood completely. You should be lying down, she said. Tell me what's happening, he said. She told him. She gave it to him quickly and without editorializing. Ferris in communications, the transmission to the relay address, the 90-minute window. Voss on approach pending course correction. Logan listened with his jaw set, and his hands flat on his thighs, and she watched him process it, and watched the moment he reached the same calculation she'd reached. "The list," he said. "Third page of the envelope. You understand what it means that they know about it. It means the people on it are going to move to protect themselves. It means some of them are going to try to pull Logan Reed's after-action reports from the Kharkov inquiry and make sure there's nothing in them that can be cross-referenced with the documents." He looked at her. "There's a Congressional Defense Committee member on that list, Emily. There's a sitting deputy secretary." She was quiet for a moment. The weight of it, the actual scale of what Logan had pulled out of that archive, hadn't fully registered until this moment. She'd been managing immediacy, the surgery, the ship, the corridor, the envelope. She hadn't stopped to consider what it meant that 11 people currently in positions of significant institutional authority had their names in a document that tied them to a deliberately engineered intelligence failure that had put 6 people into a valley under false pretenses. "Brant!" She turned to find the surgeon, who was standing at the monitoring station with the expression of someone who had understood approximately half of what was happening in his medical bay and was managing it by focusing on what he could control. "How critical is it that Logan stays in that bed for the next 2 hours?" Brant looked at his patient, at the monitor, at Emily. "He should stay in the bed," Brant said. "His pressure is stable, but he's 4 hours post-surgery on a thoracic repair. Movement risks. I'm not asking about risks. I'm asking how critical." "Significant rest is strongly indicated," Brant said, and then when she kept looking at him, "He won't die from being upright for a limited time if he doesn't exert himself. But if his pressure drops, it won't drop," Logan said, which was not a medically valid statement but was the kind of statement Logan made, and Brant looked at him with the expression of a man who had learned that some patients made their own decisions. Stokes came back into the bay. His face had the quality of events moving faster than preferred. "Halsey has confirmed course correction," he said. "We'll be back in position in 22 minutes. Ferris is locked in communications." He paused. "He's talking. We can hear him through the door. He's on a personal device, not the ship's system. He got his own transmission out before we locked him in." "We know," Emily said. "Voss intercepted part of it." "Then Voss knows the clock is running." He looked at the envelope in his own hands. He'd been holding it since she'd given it to him. He held it toward her. "This goes to Voss directly. Not through me, not through the ship's chain. You carry it." She took it. She looked at Stokes and she did the calculation one final time. Who he was, what he told her, what the 14 months of cooperating with Voss cost a man in his position. What kind of person did that quietly and without appearance of it? And she filed the result. She put the envelope back in her pocket. The ship reached its previous position 17 minutes later, slightly faster than Halsey had projected, which meant someone on the bridge had pushed the engines and decided it was worth the notation in the ship's operational log. Emily appreciated that without knowing who'd done it. Voss's vessel came alongside at dusk. Emily stood on the deck with Hale and 2 of Stokes's escorts, and the ocean was gray and flat, and the other vessel was a nondescript research configuration ship that would not draw a second look from anything passing at distance. A small inflatable came across the water between them. Petra Voss was not what Emily had constructed in her mind from Logan's brief description. She was mid-40s, compact, with the kind of face that didn't offer much and had probably made that choice deliberately. She came up the ladder from the inflatable with the efficiency of someone who'd done operational boarding before and didn't need help with the last rung. She looked at Emily immediately. Not at Stokes, not at Hale. At Emily. "You're Carter," she said. "Yes." "You have the documents." Emily took the envelope from her pocket and held it out. Voss took it without ceremony, opened the waterproof seal, and did a rapid inventory. Not reading, just confirming page count, confirming the separate fold on the 3rd page. She looked up. "The list," she said. "3rd page," Emily confirmed. Something moved across Voss's face that was not dramatic but was definitive. The expression of someone who had been looking for something for a long time and had just put their hands on it. "I need 30 minutes with this," Voss said, "and then I need Logan Reed's verbal confirmation of chain of custody for the retrieval." She looked at Hale. "And yours for the archive access history." You'll have both, Hale said. Voss looked at Emily one more time. They told me to look for Iron Wolf, she said. I wasn't sure what to expect. Nobody ever is, Hale said mildly from his wheelchair. Voss almost smiled. She tucked the envelope inside her jacket and moved toward the section of the deck where Stokes had arranged a temporary workspace, and she sat down and opened the envelope with the focused attention of someone who had earned the right to read very slowly. Emily stood at the rail and looked at the water and let herself breathe for what felt like the first time in several hours. It was not over. The documents were with Voss, but the people on the list were already moving. 11 names, and most of them had phones and lawyers and the institutional reflex of powerful people who felt the ground shift under them. The next several hours would be the most dangerous kind of dangerous. Not physical, but procedural, the kind of threat that moved through offices and communication channels and formal denials. She heard footsteps behind her. She knew the weight of them. You should be in the medical bay, she said, without turning. Logan stopped beside her at the rail. He was upright, and he was pale, and he was doing the careful breathing of someone managing pain by deciding not to think about it, which was a technique she recognized because she'd taught it to him. Voss has what she needs, he said. She has part of it. The chain of custody confirmation still needs to happen. I know, 10 minutes. He looked at the water. Emily. She looked at him. He looked older than the photograph. He looked like someone who had spent 6 years doing something very difficult in conditions she didn't know and hadn't been told. He also looked, and this was the part she hadn't been ready for, like someone who had been waiting for this specific moment for a long time and wasn't entirely sure what to do with the fact that it had arrived. I'm sorry, he said, for vanishing. I know you read the report. You didn't vanish voluntarily. No, but the 6 years after, there were points where we could have found you sooner. I made decisions about timing. He was honest about it, which she'd always valued about him even when it was inconvenient. I thought you were safer not knowing we were alive. And then I thought you'd built something you deserved to keep building. And then I told myself those were the reasons, and eventually I had to admit they weren't the only reasons. She waited. I was ashamed, he said, of what I couldn't prove yet, of the 6 years it took me to get those documents. He looked at the water. You deserve the truth faster than I gave it to you. She stood with that for a moment. The ocean moved. The Declan's hull moved against it. You're 4 hours post-thoracic surgery, she said. Whatever conversation we're having about the last 6 years, we're having it when you're not this pale. He made a sound that was close to a laugh and immediately regretted it, based on the way he held his side. Go back in, she said. He went back in. She stayed at the rail until Hale's voice reached her from behind. Voss needs you. She's found something in the documents beyond what Logan described. She turned. Hale's face had the particular careful expression of someone who had looked at information and understood it to be worse than expected. What? She said. The list, he said. Logan told you there were 11 names. Yes. Hale looked at her steadily. There are 12, he said. The 12th name was written in a different hand than the others, added later, separately. He paused. It's someone on this ship. She went still. Not Ferris, Hale said. Ferris is the operator. The 12th name is the person who put Ferris on Stokes' staff. The person who arranged the fabricated file. The person who has been on this ship since before Logan's extraction was arranged. He held her gaze. Voss needs you to look at it, because it's someone who has been in direct proximity to you since you boarded. She walked toward the workspace, where Voss was sitting with the documents open, and she felt the ocean beneath the deck and thought about the specific geography of the last several hours. Who she'd spoken to, who'd been near her, who'd known exactly where she was at every moment since the helicopter had touched down. Voss looked up when she reached the table. She turned the 3rd page over and pointed to the bottom, where the 12th name had been written in a hand that was slightly smaller, slightly more controlled than the others, like someone who had added it carefully, after the fact, knowing exactly what they were signing. Emily looked at it. The name was Brandt. The name sat on the page, and Emily looked at it the way she'd learned to look at things that required immediate action without the luxury of an emotional response first. Brandt, the surgeon who'd gone in after the second fragment, who'd closed the intercostal bleed she'd called at exactly the right moment, who'd been in the medical bay with Logan for 3 hours before Emily arrived, and with Mason in the adjacent room, and who had access to both men's intake documentation, their communications with the ship's command structure, their physical conditions, and the precise timeline of the surgery. Who had been standing in the doorway of the medical bay when she'd left to look for Hale. She looked at Voss. When was the 12th name added? The ink composition and document aging are different from the original list. Forensics will confirm, but my read is it was added within the last 18 months. Voss's voice was controlled and fast, which corresponds to when Brandt was assigned to the Declan. He wasn't on this ship before Logan's extraction was arranged, Emily said. He was placed here for it. Same as Ferris, different function. Voss closed the document carefully. Ferris was the operative, the access, the leak, the transmission. Brandt was the contingency. If Logan survived extraction and made it to the medical bay, Brandt was positioned to ensure the documents didn't survive with him. Emily thought about the surgery. 91 minutes. Brandt's hands, which had been good, genuinely good, she hadn't performed that, and she thought about the specific moment she'd called the bleed, and Brandt had found it and dealt with it, and she wondered whether the surgery had been real or theater, and she landed on real, because Logan's pressure had come up, and Logan was alive, and if Brandt had wanted Logan dead on that table, he'd had more than enough opportunity, which meant Brandt's job wasn't to kill Logan. His job was to find the documents first. He checked the intake bag, she said. Almost certainly. He found the pocket empty. He told Stokes someone came in and checked it, but it was him. He's the one who checked it and then reported it to Stokes to deflect. The construction assembled itself clearly. He was watching to see who Stokes would react to, trying to identify who had the documents. And he couldn't find them because you had them in your pocket. Voss looked at her. He's been watching you since you boarded. Emily turned toward the door that led back into the ship. He's in the medical bay, she said, with Logan and Mason. She was moving before she finished the sentence. She didn't run. Running on a carrier deck at dusk with escorts and a locked communications section and a general security posture already elevated was not the way to arrive at a medical bay without announcing herself from 3 passageways away. She moved at the fastest pace that looked purposeful rather than urgent, and Hale's corpsman Marcus fell in behind her without being told, which she appreciated. The medical bay door was closed. She pushed it open. Brandt was at the monitoring station. He had his back to her, and he was looking at something on the status terminal. Not Logan's vitals, the general ship status display, the same one Emily had used to read the navigation heading. His posture was wrong. She identified it in the first half second. The set of his shoulders was not the posture of a doctor checking on a patient. It was the posture of someone monitoring a situation. He heard the door and turned. He looked at her face and she looked at his, and there was a moment, brief, maybe 2 seconds, where they both knew, and both knew the other knew, and the room recalibrated around that shared understanding. Reyes was at her station. Logan was in the bed, awake, watching. The room was otherwise empty. "Carter?" Brandt said. His voice was professional. Only someone who'd been watching him closely would notice that it was too professional, too even, too normal, the way voices went when people were performing normalcy. "Step away from the terminal," she said. A pause. "I'm checking patient." "Step away from it." He stepped away from it. He held his hand slightly out, not a surrender gesture, just visible. He was thinking. She could see him thinking, the way you could see calculation in a face when the face had stopped bothering to hide it. "Reyes," Emily said, without looking away from Brandt, "go get Vice Admiral Stokes. Tell him to come here directly." Reyes moved. Emily heard the door open and close. The room was 3 people now. Her, Brandt, Logan in the bed. "Ferris is locked in communications," Emily said to Brandt. "He's been there for 40 minutes. He made a transmission before we locked him in." She watched his face. "You know that. You know because you and Ferris have been in communication since you came aboard this ship." Brandt was quiet for a moment. He looked at her with an expression she couldn't immediately categorize. Not guilty exactly, and not defiant. Something that was closer to tired. The specific tired of a person who had been maintaining a performance and was calculating whether to keep performing. The documents Reed retrieved, he said. You have them. They're with NCIS. They've been with NCIS for the last 40 minutes. Something moved across his face. Not panic, a recalculation. Then it's done, he said. Not to her exactly, more the way people said things that were meant for themselves. It is, she said. He sat down on the chair that had been beside Logan's bed. He sat down without drama, the way a person sat down when the weight of something became too specific to carry upright anymore. He put his hands on his knees and he looked at the floor. I wasn't supposed to be the doctor, he said. I have a daughter, she's 9. He said it without context, without justification, just as a piece of information that he apparently needed to put somewhere external. They had information about her mother, things that... He stopped. It doesn't matter. No, Emily said. It doesn't. She didn't say it cruelly, she said it because it was true. The reasons people did what he'd done were always there, always real, always more complicated than the simple noun trader covered, and they also didn't change the shape of what he'd done. Both things were true at the same time. She'd learned that in a valley 6 years ago, where the reasons for the intelligence failure had been real and considered, and had still put 6 people in the ground, or as good as. Logan was looking at Brant from the bed. She couldn't read exactly what was on his face. It wasn't rage. Logan had never been the rage type. It was something that had more distance in it than that. Stokes arrived 4 minutes later with Hale and 2 security officers and Voss, who had apparently decided that the workspace on the deck could wait. Brant did not resist. He stood when asked to stand, he confirmed his name and rank when asked, and he was escorted out with the particular quiet of people who had decided the situation had already produced enough noise and didn't need more. Hale watched him go. That's the contingency, he said. With Ferris and Brant both in custody, the operational network on this ship is gone. The network off this ship isn't gone, Voss said, but it's about to be. She held up the envelope. I've already initiated the formal inquiry process. It can't be pulled back. It's in the system now, time-stamped, with Hale and Reed as confirming witnesses. The 11 names plus Brant are looking at federal charges. She looked at Emily. This is what 8 months of work looks like when it finally moves. What happens to Brant's daughter? Logan said from the bed. Everyone looked at him. His 9-year-old daughter, Logan said. He mentioned her. What happens to her? Voss looked at him for a moment. There are support structures for families of... I'm asking what actually happens to her, not what the structures are. Voss was quiet for a beat. Her father will face consequences. That's unavoidable. What she goes through after that depends on a lot of factors. She paused. I'll make sure his cooperation is noted, if he cooperates. Logan nodded. He lay back against the rail. He was pale in a way that said the last 30 minutes had cost him something his post-surgical body hadn't fully had to spend. Emily crossed to the monitoring station and checked his pressure, 98/64, lower than she wanted. Back down, she said. He adjusted without argument, which told her more about how he was feeling than any monitor could. The formal debriefing took place the following morning in the ship's conference room, and Emily sat at a table for the first time in this whole sequence of events and understood from the configuration of the room, Voss at the head, Hale to her left, Stokes across, a court reporter, 2 additional NCIS officers she hadn't met, that this was not an informal conversation. This was record. She told her account from the beginning, the waiting room, the laceration, the termination, the helicopter. She told it the way she told things, without editorializing, without performance, with the accuracy that came from a person who'd trained herself to observe correctly because in the environment she'd worked, wrong observation had consequences. When she got to Kharkov Valley, the room got quieter. She told that part too. She told it for the first time in 6 years to people who were authorized to hear it and who were writing it down, and she told it without the modifications she'd made to the story in her own head over those years. The ones where she'd taken responsibility for things that weren't hers to carry, and the ones where she'd edited her own competence down to fit the size of what had seemed like a failure. She'd saved Logan. She'd saved Mason. She'd pulled both of them out of a field position, that had been designed by someone's deliberate action to be unsurvivable, and she'd done it with what she had, which was not enough, and had been enough anyway. She'd known that abstractly. Hearing herself say it in a room where it was being recorded made it something different, not lighter, more real. Hale confirmed her account from the Oversight Board's classified review. He'd been trying to say formally what he now said formally. The Kharkov after-action report had been deliberately structured to obscure the real sequence of events, to eliminate the record of Emily's actions, and replace it with a narrative that served the interests of people who'd engineered the operation's failure. She was never cited for her actions in that valley, Hale said, because citing her would have required acknowledging what the operation actually was. The citation was suppressed along with the rest of the record. Voss made a note. That will be corrected through the formal inquiry process. After the debriefing, Emily sat in the corridor outside the conference room for a while, not doing anything, just sitting in the particular quiet of a ship in low-activity morning hours, the hum of the engines beneath her, the distant sound of crew operations on the deck above. Mason found her there. He'd been cleared to move around the ship with his bandaged arm in a sling and the light sensitivity managed with a pair of glasses that someone had found for him from somewhere. He came down the corridor with the slightly careful gait of someone whose ribs were still arguing with him and sat down on the bench beside her. They sat in silence for a while. It was a comfortable silence, the kind that existed between people who had known each other in conditions where silence was often the right choice. Logan's pressure is back up, Mason said finally. I know. I checked at 6. Of course you did. He looked at the opposite wall. He's going to be insufferable when he's recovered. He's already asking Reyes for situation reports. She's going to start hiding from him within a week. 2 days, Mason said. She's got a faster learning curve than most. The silence came back, less weighted this time. You okay? Mason said. She thought about the honest answer to that. It was a more complex question than it appeared, and she gave it the consideration it deserved rather than the reflexive fine that she'd been issuing for approximately 4 years. I think so, she said. Ask me again in a month. He nodded. That was the right answer, and they both knew it. You didn't process 6 years in a conference room and 1 corridor morning. You processed it slowly, over time, in the ordinary days that came after, and some of those days were fine and some weren't, and that was the actual shape of recovery, which bore little resemblance to how recovery was usually described. What are you going to do? Mason said. I don't know yet. She meant it. The apartment in Riverton still had her lease on it, 3 months left. The cardboard box with the pen and the hair tie was presumably still in the lobby of Northgate Medical Center. She had no current employment and a termination letter in her scrub pocket and a background that had just been formally entered into an NCIS record. Stokes wants to talk to you, Mason said. He's been circling, very politely. I know. He's not going to stop circling until you let him talk. She stood up. Her knees were stiff. She'd been sitting longer than she'd registered. She stretched once, plain and unself-conscious, and looked down at Mason. Give Logan my love, she said, and tell him if he pulls another IV line, I will personally hold his arm down. Mason's mouth curved. I'll tell him exactly that. He'll probably still do it. Yes, she said, he will. Intan. Stokes was on the deck. He was standing at the rail looking at the water, and she wasn't sure if that was genuine or staged. He was a man capable of staging things, and she decided it didn't matter and walked up beside him. The ocean in the morning was different from the ocean at dusk, less dramatic, more honest. You handled Brant well, he said. I didn't handle him. He sat down. You gave him room to sit down. That's handling. He looked at the water. He's cooperating with Voss. It started at 0400. He's given her 3 additional names not on the list, people in supporting roles and administrative positions. The network is wider than the document showed. Will it be enough? The deputy secretary resigned this morning. His voice was carefully neutral on it. Before the formal charges, which means someone told him it was coming and he made a calculation. The congressional member is going to be harder. He's retained counsel and is already making noise about procedural irregularities. He glanced at her. He won't get far. The chain of custody for the documents is airtight. You carrying that envelope in your pocket turns out to be the cleanest possible record. She almost said something about the irony of that. Her, the fired floor nurse, being the cleanest link in a federal evidence chain. And then she let it go, because irony wasn't what the moment needed. I owe you something, Stokes said. You don't. I do. We found you 3 days ago. In that time we brought you onto a ship, exposed you to an active security breach, put you in surgery, and then asked you to carry classified documents through a corridor while someone was actively looking for them. He paused. None of that was in the parameters of what I told you when I asked you to board the helicopter. You told me there was someone critical who needed me, and I knew when I said it that it was more complicated than that. She looked at the water. It was gray-green in the morning light, moving in long, slow swells that the ship accommodated without apparent effort. She thought about what it would mean to be angry about the way she'd been brought into this, and she assessed that feeling honestly and found it was present but not the dominant thing. The dominant thing was something she was still identifying. Relief, maybe. Not the simple kind, the kind that came from setting down something heavy enough that you hadn't noticed it changing your posture over years. Northgate Medical Center, Stokes said. The director, Vogel. She waited. The military community has a long memory for how its veterans are treated, he said. Colonel Hale's account of sitting in that waiting room for 47 minutes has already been shared with the hospital's board of directors through private channels. Apparently he was specific. He wrote a formal account of the incident, including the documentation of Vogel's response, the public termination in front of staff, and the policy citations that were used to fire you for suturing a laceration. He looked at her. The board has initiated a review of Vogel's conduct. That review began yesterday. She said nothing. I also spoke to the American Nurses Association credentialing office this morning, he continued. Your termination paperwork, based on the circumstances I described, will be reviewed as a potential retaliatory action. Your record is clean. It will stay clean. She turned to look at him directly. You did all of that yesterday. I did some of it yesterday. Hale did the rest. He held her gaze. He's a stubborn old man who bled in a waiting room for 47 minutes and has a very clear sense of what a debt looks like. She thought about Vogel in the conference room, the termination letter slid across the table, the measured recitation of policy violations like they were the whole vocabulary of what had happened in Bay 6. She thought about him saying pattern in the tone he'd used, the specific dismissiveness of it, the way he'd looked past the old soldier in the bed and seen only a liability she'd created. She didn't feel satisfaction exactly. What she felt was the particular completion of something that had been unfinished. Not revenge, not vindication as a performance, just the simple correction of the record. What was wrong, named. What was true, confirmed. There's something else I need to tell you, Stokes said. She waited. The Navy is establishing a Veteran Medical Response Command, a national program, rapid deployment medical teams for veterans in crisis, embedded with the existing VA framework, but operationally independent. Field-trained medical personnel, not administrative structure. He was choosing his words carefully, she noticed. Not performing careful, just being it. We've been designing it for 14 months. We've been looking for someone to command it for the last 8. She looked at him. The position requires someone who understands field medicine and institutional medicine and the specific gap between them, he said. Someone who knows what it means to be dismissed by a system and who also knows what it means to stay anyway, to do the work regardless. He paused. I had 12 candidates before I found your file. I stopped at 12. The ocean moved. A gull went over at some distance, not interested in the ship. I was fired yesterday, she said. I know. From a hospital that cited me for suturing a veteran's laceration. I know that too. He almost smiled. The irony is not lost on me. She turned the offer over in her mind. Not the title, not the scope, not the prestige that was presumably attached. None of that was what she was turning over. She was turning over the shape of the thing it would require her to be, which was the shape of herself that she'd spent 4 years compressing into a floor nurse in a medium-sized hospital. The shape she'd been warned by no one in particular and by everything in general was too large to be safe. She'd spent 4 years being exactly small enough. She was very tired of that particular size. I want to see the program design documentation, she said, before I commit to anything. Of course. And I want Hale involved in the veteran advocacy component, not as an ornament, as a functional advisor. Already planned. And Logan and Mason, when they're cleared medically, I want them in the room when we discuss operational protocols. They have field experience that the design team is probably missing. Stokes looked at her with the expression she'd seen on the helicopter, respect and calculus, and now something that was less calculation and more straightforward. Yes, he said. She nodded once. Not a full yes, a yes to the conversation continuing, but she knew in the way that you knew certain things when you stopped arguing with yourself about them, that the conversation was going to end in a particular place, and that place was not Riverton. She went back to see Logan in the afternoon. He was in a better position than he'd been in the morning. More color, pressure, at 112/76, the relief of a body that had been given what it needed and was doing its basic competent work of repair. He was also, as Mason had predicted, already asking Reyes for situation updates that she was no longer pretending to provide. Reyes left when Emily came in, with the expression of someone who just received a pardon. Emily sat in the chair beside the bed. Logan looked at her with the directness that had always been his particular quality, unchanged by 6 years or surgery or the specific toll of a classified operation that had almost killed him. Voss briefed me this morning, he said. The deputy secretary, the inquiry, all of it. Good. She said your chain of custody was clean. She said that to you? She said it to Hale and he said it to me. The almost smile. I have a long-range information network. It involves a 70-year-old Army colonel and a corpsman who makes excellent coffee. She looked at him. She thought about 6 years in photographs and the specific arithmetic of lost time, which never actually came out even and wasn't supposed to. Stokes offered me the command position, she said. He was quiet for a moment. What did you say? I said I wanted to see the documentation first. That's a yes, he said. It's a qualified preliminary yes. Carter. He looked at her steadily. You've been qualified for that position for 8 years. You were qualified for it before Kharkov. The only thing that changed is that now there's a record that says so officially. She looked at the monitor. His pressure was holding. His oxygen sat at 97. I'm not the same person I was before Kharkov, she said. Neither am I. He said it without weight, just fact. That's not a problem. The position doesn't need who you were. It needs who you are now. He paused. Which is someone who sutured an old man's arm in an overflow bay and got fired for it, and then walked onto a Navy carrier and held the evidence chain together with her bare hands while a security breach was in progress. He looked at her with the steady look. The version of you that came out of 4 years of being nobody is not lesser than the version that went in. I'd argue it's more. She sat with that. She didn't agree with all of it. She thought 4 years of deliberate invisibility had costs that Logan wasn't positioned to fully account for, and she thought the version of herself that had existed in Riverton had been genuinely diminished in ways that were going to take time to reconstruct. Both things could be true. The diminishment and the resilience, the loss and what had been built anyway, in the middle of hiding, that turned out to be more than nothing. Rest, she said finally. You keep saying that. You keep not doing it. He settled back. His eyes stayed open, watching the ceiling with the patient attention of someone who'd learned to be comfortable with stillness. Emily, he said. She stopped at the door. I'm glad you were in that waiting room today, he said. I'm glad Hale found you. I'm glad you didn't... He stopped. Chose. I'm glad you're still here. She looked at him for a moment, the fluorescent light, the monitor, the sound of the ship around them. Go to sleep, Logan, she said. She went out. The formal ceremony was simple, which was the right call. Hale had argued against anything elaborate, and Stokes had agreed, and so it was a conference room and a dozen people and a document that said what it said in plain language without the decorative language that ceremonies usually use to soften the edges of acknowledgement. The record of Emily Carter's service in Kharkov Valley was formally corrected. The suppressed citation was entered into the official file. The Kharkov After Action report was flagged for the inquiry's review, and would be re-examined with the documentary evidence now in Voss's hands. Stokes read the corrected language himself. He read it the way he did things, straight, without performance, and she stood and received it the way she did things, without breaking, without softening, just present. Logan was there in a wheelchair because Brandt was in custody, and Reyes had apparently decided that 4 hours out of the bed was medically defensible if the patient was going to be impossible about it regardless. Mason stood beside him, arm in the sling, the beard still wrong for his face. Hale was there. Marcus had brought him coffee from the officer's mess, and Hale was holding the cup with the air of someone who had been waiting a considerable time for a particular thing to happen, and was now in the mild, pleasant aftermath of watching it happen. When it was done, when the document was signed and the record was corrected and the room had shifted from ceremony to the awkward social aftermath of ceremony, Mason said quietly to no one in particular, 6 years. 7, if you count from the briefing, Logan said. I count from the valley. Then 6. Emily looked at them both. The two men who should have been dead and weren't, who had carried their own version of the last 6 years in conditions she didn't fully know and would learn over time. The idiot grin from the photograph was still available in Mason's face when he wasn't actively suppressing it. The directness in Logan's was unchanged. She thought about what it meant that none of this had gone smoothly, that Logan had almost died on that table, that the documents had spent 20 minutes in a pocket in a corridor while a security breach was active on the same ship, that Brandt had been 2 decisions away from being a different kind of problem than he turned out to be. She thought about the things that hadn't worked perfectly, and the ways the outcome had come together anyway. Not through brilliance, not through any single act of heroism that could be narrated cleanly, but through accumulated small decisions made by imperfect people under pressure who kept doing the next necessary thing. That was how things actually worked, not the version where capability arrived and problems solved themselves, the version where you showed up with what you had, in scrubs with a cardboard box, and you did what needed doing, and it was insufficient and also enough. She'd known that in the valley. She'd known it in Bay 6. She'd known it and buried the knowledge under 4 years of trying to live small enough that the knowing couldn't hurt her. She was done living that size. The Declan moved through the Atlantic under a clear sky, and the engines were steady beneath her feet, and Logan was going to recover, and Mason was going to recover, and Hale was going to drink his coffee, and Voss was going to take 11 names plus 2 into a federal inquiry that would not be quiet, and would not be fast, and would produce consequences that were real and public and lasting. And Emily Carter, who had been Iron Wolf before she'd been a floor nurse in Riverton, who had sutured a veteran's arm in an overflow bay and been fired for it, and then walked onto a helicopter the same afternoon, was going to take the documentation that Stokes had promised her and read it carefully and ask hard questions about the operational design and probably argue with 3 people about the staffing model, and then she was going to say yes. Not because